What is decalcification? That means decalcification का मतलब क्या है ये बताओ बस.
किसी भी टिश्यू से कैल्शियम को निकालने का प्रोसेस है.
ओके. हम क्यों टिश्यू से कैल्शियम निकालें?
सर
टिश्यू से हम कैल्शियम क्यों निकालें ये बताओ.
टिश्यू से हम लोग कैल्शियम क्यों निकालेंगे? बहुत सारे उसको कट करने के लिए और
बताओ. ठीक है छोड़ो. डायबिटीज मेलाइटस और डायबिटीज इंसिपिडस. Is it same or different?
They are different.
Different. What kinds of difference basically is there?
In diabetes insipidus में it is due to the deficiency of vasopressin or ADH hormone, and diabetes mellitus it is due to the deficiency of insulin hormone.
Good. Now, what are the main cells that are responsible to produce insulin, and what will be happen if these cells are destroyed?
Beta cells from islets of Langerhans are responsible for the production of insulin. And what?
If these cells are damaged by any cause, so what will be happens?
Blood sugar level will increase.
Why?
In the bloodstream due to
How?
the glucagon hormone.
Due to glucagon hormone. So, what is the main function of insulin? What is the main function of insulin?
इंसुलिन ब्लड सेल्स में ग्लूकोज को इंजर्ट करता है.
That means insulin decrease the blood glucose level or hypoglycemic hormone. Okay. Now, what are the different types of diabetes mellitus that are basically exist?
There are three types.
Three types.
Diabetes, type 1 diabetes mellitus or insulin dependent, type 2 diabetes mellitus, non-insulin dependent, and gestational.
Okay. Now, why we call type 1 as insulin dependent and in case of type 2 insulin non-dependent? What is the baseline differences?
Type 1 insulin dependent. In type 1 diabetes, the beta cells are destroyed due to which insulin is not produced. And in type 2 diabetes mellitus, insulin is produced but the cells cannot take it.
Good. That means in case of type 1, there is no other option to give the insulin. Why? Because the cells that are produce the insulin are already damaged. That's why there are no other options except to give the insulin to the patient. But in case of type 2, the cells are present, insulin will be produced, but the cells don't get the insulin or they are resist. That's why we can use different types of medicine.
Receptors are destroyed.
Okay, good. Next, now what is the main characteristics, features of type 2 diabetes mellitus? Symptoms of type 2 diabetes mellitus.
Polydipsia, polyuria, polyphagia, wound healing is prolonged, excessive sweating, weight loss.
Now, what is the main diagnostic features of type 2 diabetes mellitus? Main diagnostic features. That means how you diagnose a patient that suffer from type 2 diabetes. What are the main diagnostic features?
Lab test. Fasting, PP, fasting PP, insulin assay,
C-peptide assay, and HbA1c. Now, just give me a proper checklist. That means pre-diabetic, diabetic, and the fasting PP level.
Starting from fasting. In fasting, first pre-diabetic, diabetic, and normal range. Normal range of fasting is 70 to 90 mg per dl. In pre-diabetic, 100 to 125 mg per dl, and in diabetic, greater than 125 mg per dl.
Greater than 126 mg per dl. So, in case of patients who are basically comes under the pre-diabetic condition, what types of advice should you give in that patient?
They should change their lifestyle to control the diabetes.
To control the further progressions of pre-diabetic condition. Very good. Now, what is the advantage or what is the significance of HbA1c test?
In HbA1c test, we can check the average blood sugar level of 3 months.
Over the period of 3 months.
Over the period of 3 months.
So, what is the advantage? In case of HbA1c, the levels that don't get affected by the diet or other things. Only we can find the better result. That means the hemoglobins and the glucose are non-enzymatically attached to the hemoglobin for a longer period of time. Yes, there is no changes in diet or carbohydrate intake or time of blood collections. Easily we can detect the exact amount, and not only that, we can basically give the better value of the patient. That means 6%, 7%, 8%.
But in the further test,
But in case
a
of
patient can eat anything or they cannot eat anything, so the values can
health will be
differ.
different. Last question: what is gestational diabetes?
It is due to in pregnancy condition the steroids hormone are produced too much. Too much production of steroid hormone causes gestational
Okay, okay.
diabetes,
What is-
which is then converted to type 2
What is-
in 5 to 10%.
Okay, okay. What is C-peptide test? What is the full form of C-peptide?
Control.
Control peptide. No. Achha, what is the advantage of using C-peptide test in case of detections of type 1 diabetes?